All right, I'd like to welcome everybody to our Friday press conference for the 10th of July. Again, we've one point going to slow down our press conferences, but the events of this past week is we felt were very important to get some information out to our residents. This week in Chautauqua County, we've seen an increase of cases. It was announced that we had 11 on Tuesday. You may recall that originally that number was 13, but after a full case investigation, we did find out that 2 of those residents resided in other counties, not in Chautauqua County. So their results were removed from our county's totals and then added to the appropriate counties that they reside in. These tests would have been completed and were completed prior to the 4th of July weekend, and they were not attributed to any single gathering or large event that took place prior to the holiday. Wednesday will follow with another additional 5 cases, and Thursday there was 1 new case to announce. Today, unfortunately, we have reached a new peak. We have 16 cases to announce today in Chautauqua County, including a pediatric case, 2 males and a female in their teens, 4 females in their 20s, 2 males in their 20s, 4 females in their 40s, a male in his 40s, a female in her 50s, a female in her 60s, and a female in her 70s. Currently, there are 35 active cases in Chautauqua County that continue to recover. 364 individuals are under quarantine or isolation orders by the public health director and continue to be monitored. That number needs to be stressed, that those 364 individuals need to pay heed to the quarantine order. It is very important that we follow these guidelines as to prevent any further spread. The other point that we'd like to make that as of July 8th, because there is a 2-day lag in data, there is nobody admitted to a Chautauqua County hospital with a diagnosis of COVID-19. This also means that nobody is in an ICU unit in a Chautauqua County hospital. To date, we have had 128 cases fully recover, 170 total cases, and unfortunately, we have had 7 fatalities. To date, there have been 17,801 tests returned to Chautauqua County as negative for the COVID-19 virus. With this week's increased cases and people interacting with one another more as the summer season continues, we want to remind everyone how delicate the situation continues to be and the need for everyone to remain vigilant and continue our social distancing to stop the spread of this disease is of the utmost importance. There's no difference from day 1 to day today, 100 and something. We must stay vigilant to stop the spread of this disease. With the increase in cases and close contacts this week, we want to ensure everyone understands that if you are identified as a close contact of a positive COVID-19 case, you will be contacted directly by the Chautauqua County Department of Health. If you do not hear from the health department, you are not considered a close contact, but should continue social distancing and disease prevention efforts, which we all will continue to do. If you are tested for COVID-19, you must, and again, you must quarantine until you receive your test results. Very important that from the time you are tested until those results come back, you must stay quarantined. Even if you don't feel symptomatic, you don't feel any symptoms, you still must remain quarantined. If you're asymptomatic and you feel the results come back positive and you do not quarantine, you're likely to expose any of your contacts during that time and make the contact tracing much more difficult. Please be considerate of your fellow community members. Think of the impact not only on yourself, but potentially exposing family members, friends, coworkers, and the continued ripple effect of their family, friends, and coworkers. This is an important issue, and we cannot stop our efforts now. This time, I'm going to turn the microphone over to Dr. Robert Burke, our county physician.
Thank you, PJ. I think This is a sobering moment for us. If you may remember a couple of weeks ago, even a month ago, we were talking about how well we were doing as a county and basically how proud we were that the county residents were showing a great degree of discipline in maintaining their social distancing, wearing masks, and our numbers showed that. We were doing extremely well, and actually the state has been doing extremely well. When we look across the nation, we see what is happening where states have opened early and the results have been somewhat disastrous because of activities, especially young people gathering in bars and in large social gatherings, not using masks. And the data coming out of there just shows widespread increases in positive cases and in hospitalizations and ICU occupancy and mortality. Unfortunately, Chautauqua County is probably much like the rest of the nation in many ways. We have now all these young people back from college or back out of school, and what we're seeing is exactly what we're seeing elsewhere. Large groups of people gathering on the lake, either Lake Erie or Lake Chautauqua, partying, and we are expecting that we're going to have the same results unless we start to really enforce, or at least have people self-enforce the standard guidelines, which are wear a mask, distance yourself, hand washing, being very careful, because this is a significant illness. And even in the young, this can be a very serious, lifelong illness with respect to the damage it can do to your lungs. All those people who have been in contact with a positive case need to self-quarantine. If you've been tested, you need to self-quarantine until those results come back. And actually, while you're self-quarantining, do us all a favor and start to look at who your contacts have been, just in case you become positive. We're getting reports from the health department that young folks who we're contacting are very reticent to give us names of people that they've been in contact with. This is absolute insanity. If we do not case find and track everybody that has been in contact with that case, we will never put an end to this. We will be chasing our tail for the next year. This is serious business, and I think people really need to take this seriously. As for parents, look, if you've got kids coming back from college, if you've got kids working here in the community, you have to make sure they understand the seriousness of this issue and what they are doing out there when you're not around. If they come home having been in contact with someone inapparently because of this lack of social distancing, sharing vaping instruments, being out on boats with groups of people, very close contacts, you run the risk of being in contact with someone who is going to bring disease into your house, affect either an elder grandparent or yourself. Plus, we run the risk, finally, of this thing mushrooming and exploding and undoing all the good we've done with respect to getting to this place economically where we're beginning to open up and see our economy grow again. I cannot emphasize enough to the parents that you have to be mindful to bring this message to these young folks who obviously think they're invincible, and really this will never happen to them. There is an old song which many of you parents have heard from Crosby, Stills, and Nash, and in it says, teach your children young and be smart about this. Make sure they understand the risk that they are bringing into your household by doing this.
Thank you. Just to provide a brief update, our enforcement actions, Sheriff Quattrone and I continue to receive daily complaints from the PAWS task force, which are followed up and dispersed and distributed to the local municipalities should they have a police agency. If any individuals wish to issue a compliance order or a failure to comply order, you still may do so at the New York PAWS Enforcement Task Force by calling 1-833-789-0470 or visiting coronavirus.health.ny.gov/New York State PAWS. We get these throughout the day, several a day, and we get these out to the law enforcement agencies to follow up. Education has been our key, educating those who are non-compliant. And if they are, continue, then we take actions as we have earlier with one of our businesses receiving a cease and desist order. Most businesses are doing a great job to ensure the safe environment in their businesses. If you've been closed for 3 weeks and have an opportunity to open, you're going to do whatever you can to do the right thing and ensure your business can survive. But one happy example we'd like to give is our local Walmarts. Now I can tell you, and so can Sheriff Quattrone, and this is also has resonated through several control rooms across New York State. The Walmarts were a source of contention and a source of several of our pause complaint orders on a daily basis. Prior to this, we had set up a meeting and we had met today, but as of Thursday, all Walmarts were now complying with the New York State guidelines and protocols. They have one entrance. You will go in and out of the grocery entrance of all Walmarts in New York State. They have hired third-party security to make sure that the enforcement of the mask inside the store and as you enter will be encouraged. Again, those with medical conditions will be able to say that. Walmarts both have masks there available if you forgot yours, which many people do. If you forgot your mask, they will provide one for you. But we're urging everyone. It's not a matter of your civil liberties being violated. We know people are upset and everyone is entitled. But what we want to make sure everybody is safe for yourself and safe for others. But again, the Walmarts are following very stringent guidelines. Corporate has sent out several guidelines for them, and we found out today that their opening is opposite of ours, is they are now going from phase 4 to phase 3. As you enter new phases, you go down in number. We have gone up in number. But speaking to both Walmart managers, they've done a great job. Implementing these new protocols with several hundred employees has been no small feat. And again, hiring a third-party security group has been very important as we start to get this message across. The other piece is they're being trained in the de-escalation techniques. So we want to remind everybody that, if you're asked, please comply. And if not, there are matters that you can discuss with those individuals in a calm and civil manner. Again, they're reducing their foot traffic, and I've highlighted before, several other businesses are also coming up with innovative ways to stay open while maintaining the safety of their employees and their customers. As we move through this, a lot of analogies can be made, but one of the things that I've used with my athletes throughout, as I've spent 27 years now as a coach, I've told them all, especially in the sport of wrestling, you wrestle for 6 minutes, the entire 6 minutes. You don't stop with 10 or 30 seconds left, because in that sport, you can get put to your back and the match could be over. In a football game, you don't stop with a minute left or 30 seconds. As we know, all it takes is a 10-second run down the field and a touchdown scored and you lose the game. There's no difference in this in a game of life. You continue until the final whistle is blown. We don't know when that's going to be, unfortunately. That's why I've asked the governor for more phases. And I think this now more than ever shows the reason for those phases, to realize that we are not out of the woods. We have not reached the finish line. Phase 4 we've reached, yes. We don't know what other phases are beyond. I'm asking for more phases so people realize that we need to continue this vigilance. We need to continue wearing masks. We can open in a safe manner, and it's been done so. We've demonstrated that. But we need to pay attention to the guidelines and the protocols that have been established. Remind everyone, just because we're in phase 4 does not mean we're out of the woods, I've said, and we must continue to do the right things. Chautauqua County's done a phenomenal job of doing the right thing, and we need to continue that. We can't point the blame at any one person or any one group. We need to all take this and learn from it. If we let our guard down now, we run the risk of everything we've done to this point going right down the drain. We run the risk of our family and friends, the neighbors, and potential health risks, but also the entire economic setback of a region. I was very sheepish when I had to explain that we had a rise of 13 cases. And today in my control room, I will have to go again and say now we have 16. And something I've lauded that our prevalence has been low, and it has been low, and it still remains low. But we need to make sure everybody continues their hard work to keep this region moving forward. We need to keep up our diligence, we need to keep up the fight, and we need to keep up wearing our masks and doing the things we've asked from the very beginning. At this time, we're going to open it up to questions from the media. We'll allow for 2 questions to begin with, just realizing that we do have a hard stop a little before 4 o'clock so I can get down to our control room meeting. At this time, we will open up the list. We'll start with Mr. O'Connor from Chautauqua. I think you might still be muted, Dave. Dave O'Connor, are you with us? All right, we'll move on. From the Post-Journal, Dennis Phillips.
Thank you, PJ. Is it known if these 16 cases that you announced today are stemmed from any 4th of July holiday activities, or would this have been before, would they have been tested before the 4th of July?
We don't have that information now that as you get 16 in one day, that's there have been contact tracing and moving.
I have the,
Okay, go ahead.
none of these are related to, they're related in many senses to each other, family, group gatherings, whatever else, but nothing to 4th of July. Actually, it's a little early to pick up that kind of caseload just because it takes a while for those people to turn positive with testing. These are all just people who were in contact with someone else who we knew about, or I don't think any of it is 4th of July related, though it is related to people getting together in either family groups or small groups with someone obviously who was positive.
Thank you, Dr. Burke. With these increased numbers of COVID-19 positives, PJ, do you think this will impact the reopening of the economy, hospitalizations, or deaths being contributed to these new increased positives?
Well, one of the things we talked about from the very beginning prior to any of our openings was that as we moved into the opening phases and more testing became available, we would see an increase. To the point we don't see an increase in our hospitalizations, which is key. I'm very cautious. I don't know. I don't know what these numbers will bring to our totals. I know the hospitalization rate is the key to what we're looking for in our control room. As long as we're not burdening our healthcare system, this should continue to reopen. But will it affect the economy? Yes. If you've got 360 plus individuals under quarantine or isolation orders and not moving about, could that impact the economy? Certainly. I'm hoping that this does not impact the economy of the entire Western New York region. I'm hoping that our numbers, the small numbers we have, don't turn into larger percentages and run the risk of holding us back. But I know the numbers they look at are hospitalizations, and without any hospitalizations right now, we still are moving forward. But again, we need to be very vigilant.
I guess one of the other numbers we look at is percentage positivity. How many tests we're doing, how many are positive. And as you know, if you look at Florida, some of the counties are running at 26, 28% positive cases. That is a tragic number. We are really still very, very low prevalence. But the thing that worries us in public health is when you see 11 cases, then you see 16, and are you seeing the canary dead in the coal mine, or are these just two little spikes? And I guess we are obviously concerned and redoubling our efforts, but the question always comes back to discipline, personal discipline, caring for others by wearing a mask, self-disciplining. This is where the action is. This is where this has been shown everywhere else in the world to work. And there's no reason why it can't work here, but it requires discipline. And it requires caring for your fellow citizens, your fellow family members, by knowing that when you wear that mask, even if you turn out positive, you're probably not going to infect anybody else. There was a recent study which was really interesting on families where there was a positive case with multi-generational individuals in the family unit, and those families where everybody wore a mask had no spread. Those where masks were not used had tremendous amount of spread and morbidity and mortality. So it works. It's just a question of discipline. And this is tough, but discipline is something that people around the world have learned to manage. PJ was talking earlier about his family coming from Eastern Europe, mine too. Those people sat in basements for 5 years while war went back and forth over the top of them, and then emerged to continue on. And it was the discipline of staying the course under very tough circumstances. Here we're asking people to put a darn mask on. Come on, give me a break. This is not exactly going to kill anybody, and it's going to make sure that we break the back of this thing, or it breaks our back, as PJ was saying, both personally with respect to what it's going to do to certain people, and also the economic potential of this community, which is already suffering from this.
Thank you, gentlemen.
Thank you. Moving on, WJTN, Terry Frank from Media One.
Yes, good afternoon, PJ. I had a little bit more of a technical question, and I don't know if you or Dr. Burt can handle it or tackle it, but I'm aware of a situation, and I won't say any more than that, but I will mention that I know of somebody who had contact with somebody from out of town. They didn't hug or anything like that, but the friend from Pittsburgh apparently tested positive for COVID. The other person that was involved did have to quarantine and have a test done. That test has come back negative. Now, because of the time period, 3-4 days between the visit and having tested, does that person have to have another test to go back to work or get out of quarantine?
I guess each of these situations requires a little bit of evaluation with respect to, there are guidelines of if you test positive, how long you need to quarantine, when you can go back to work. These guidelines have morphed a little bit. Initially it was 14 days, then it was 10 days if you had 3 days without fever or cough. And if you're just a contact and have tested negative, it all depends on when that contact took place, how long it's been since you were contacted. If you were quarantined, it may be a good idea to retest. We know these tests aren't perfect. If you had that close a contact with someone who was obviously positive, retesting may not be a bad idea, because depending on when the testing was done and the technique used, they're not perfect. And again, depending on what the work situation is. If you're going into an office where you're sitting all by yourself, no contact with anybody else, sitting there all day tapping away at a computer is one thing. If you're in a situation where you're an essential worker, meeting with folks, doing everything else, a retest may be advisable. But it really depends on the situation.
Very good. As too, generally, how are we set in Chautauqua County as far as testing goes? Because I know across the nation where we've been seeing these real hot spots, these areas of spike, they have been lacking in tests. I thought that we were pretty much caught up on that. Are we generally, and how are we in the county?
In the county, we are capable of testing. There's been some information that one of our testing facilities ran out of tests. That's not affiliated. We haven't gotten official word on that yet, but all of our testing locations that are affiliated with the county we haven't heard anything yet that they're running low on tests. The state has gotten that out. We have talked at length in our control room that if we do need testing supplies, the state will get those out. But as of right now, the information we've got from the control room is our testing capability and the supplies are there. Should we need them, they'll be requested. So I feel confident we can do the testing if needed, but we haven't heard of any shortages yet.
There's an interesting problem, which this is kind of fascinating when you look at it. Back in February, March, April, the big problem was we didn't have enough testing material, which was a problem because that was the opportunity at the time for us to case find, test, and control. Now we basically have enough testing material. Unfortunately, the other end of it, the labs are running at capacity, and the time to get an answer back, unless you use a rapid test, which we are saving for people who we critically need to know within 45 minutes. The standard test, which originally, when we were in short supply of test material, we could get back in a day or two. That time, because the labs are being stressed by testing in nursing home, testing the worried well, testing in people who need a test before they can fly to Puerto Rico, testing prior to pre-op surgery, the pre-op testing, the labs are now running 4, 5 to 7 days with a result, which is not good either, because then we get a result with someone 7 days after we would want it. So yes, there is enough testing supply available. There's a slowdown in the results, which has to do with the machines and the availability of the machines at $60,000 to $100,000 a pop to do this. This mismatch is really not that good a situation at the moment. And these machines break down, and they're being pushed way, way beyond what their capacity originally was designed for, which was occasionally a few times a day. They're running 24 hours a day. And as we know about machines, no matter what they are, you run them 24 hours a day, they have breakdown, maintenance, whatever else, which just slows the whole process down.
Thank you, Dr. Burke. Thanks, BJ.
You got it. Thanks, Terry. Moving on, Western New York News Now. Justin.
Yeah, so in regards to the masks and the lack of people wearing masks in public places, why do you think that there is such a pushback from a lot of people in the community?
Well, I guess I would just differ a little bit, Justin. I don't think there's a growing number of people that don't wear masks. There are people that do not. Why they don't, we're not quite sure. Some people have a philosophical belief. Some people have medical conditions. We're just asking everybody to just be mindful. What they do, we've heard this so many times, the steps you take are helping others as well as yourself. So we just want everybody to remain vigilant with that. We're not here to debate reasonings. Somebody was concerned, one of the managers at Walmart spoke that they had received complaints that you're asking about my medical history if I say I don't have one. They're not. They're just asking, do you have a mask? No, I've got a medical condition. Okay, thank you. The idea is not to be confrontational. It's just to remind people. And honestly, we've all heard it. I know this morning I got out to pick something up and got to the door and my mask, went right back to the car and got my mask on. So, people do forget sometimes, but, for the most part, I will say, a large majority of the residents of Chautauqua County wear their masks. They're doing the right thing and they're helping others. So,
yeah, and you urged at the start of the press conference for people who are under that quarantine, either they're waiting for a test or what have you, to make sure that they stay disciplined and they stay under the quarantine. Is there a specific reason for that? Are people not following the guidelines of the quarantine, or is this just a general reminder?
It's just a general reminder. Throughout this time, I've received different phone calls of, we need to keep the message out there. We need to keep it going. So, as the cases come up and as we see these spikes, we just want to go over those steps that we reiterated from the very beginning: washing your hands, maintaining safe distances, have a little self-discipline when it comes to wanting to go out in these big group events or trying to get together in large groups, and wearing your mask. So, we're just going back, and especially the quarantining, we want to make sure that people don't think that, I'm not sick, I can go about it, and then if I get the test, well, then I'll deal with it. Well, just the opposite. If you get tested, for example, if I got tested today, and I went about my daily business, and I stopped at the grocery store, I stopped to pick something up, and I come in contact with different people, those are all people that run the risk of potentially being infected, especially if I come back and test positive. There's been so many cases of asymptomatic positive tests returning. So, you don't have to be sick to test positive. We found that out. So we want to remind everybody that, we need to stay the course. Once that test has been taken, you need to quarantine, and it's 14 days. And some people, if you're a college student who's here for a few months or a few weeks and are trying to raise money to get back to school, that might seem like an eternity. But, when you look at it, maybe once you get older, 14 days is a blink of an eye, if maybe a half a blink, that it goes by so fast. But we ask everybody to continue that vigilance of quarantining until you get those results. Just, again, to prevent that spread if you should become positive.
Okay, thank you.
Yep. We'll go back. Mr. O'Connor, have you joined us?
I have joined you. Can you hear me?
Yes, I can. Go ahead.
Okay. You have to remember, not only was I born in the previous century, I was born in the middle of the previous century. So, you know, this technology sometimes overwhelms me. First question, it seems to me that as I travel around and look around, that they say, well, you've locked the barn door, but the horse is loose. But it seems to me, Dr. Burke, that we have several barn doors. For example, I was on the lake 4th of July weekend, and there were, you know, as always, 10, 20, even 30 watercraft rafted up, as they say, people going back and forth. And there, I've also covered Jamestown Justice Coalition sessions where there was most of the people wore masks, but there was no social distancing. My question is, when we concentrate on places where you really can leverage your power to more or less enforce wearing a mask, what about the places that there is no leverage? Boats rafted up, social picnics, Black Lives Matter demonstrations. How is that controlled?
That's a very interesting question. It takes me back to when I was on vacation with my family in Cancun, actually, just before this all started. And we saw this all coming about, and my wife turned to me and she said, do you think this nation has the discipline to handle this? And what we are seeing now is that there are certain folks in this county, in this nation, that either don't have the discipline or cannot figure out what the implications are that they're going to create with their lack of discipline. We cannot do what they did in communist China with respect to police on every street corner with the temperature probes and everything else and locking people. I mean, that's just not what we're used to doing. And we are a country that prides itself on personal freedoms, but also that people understand how to look after each other in their community. And what amazed me when I moved here from Canada, and I lived in a small town about the same size as Westfield where I live, was the phenomenal degree of organization that existed in the town with respect to all the things that went on, you know, for kids and for adults leagues and this and that. And it seemed to be highly integrated and networked. Much more than the community I lived in Canada. And I was impressed with the fact that people had a sense of community. And that's what we're depending on here is people's understanding that this is a significant issue and we have to make sure that everybody understands what their part to play in this is. And you're very right in pointing out that there are holes in the fabric that we're identifying that are great risks to us. Pontoon rallies on Lake Erie or Lake Chautauqua or Finley Lake or wherever else. I got a report this morning of work crews, you know, doing something that nobody wearing a mask, young kids for the summer, you know, having a job. I mean, this is all just a portal that this virus will find because it is a cunning, lethal in some instances, aggressor that will find its way through if we allow it. And the places, if you look around the world, New Zealand, Korea, they figured this out and they are really aggressive at making sure that this doesn't happen. But it requires discipline. And it requires us making sure our family members, our kids especially college kids, high school kids, understand the part they have to play in either keeping us all safe or really bringing the hammer down on someone in the family who may end up face down in an ICU with a tube in every orifice they have, gasping, and may not make it. I mean, that's the end result if you're not careful. And that is happening nationwide daily. And I agree with you that we have a problem with respect to not everybody is staying attuned to the message that we have to stay the course on this.
Second question. We have with COVID a public health emergency, yet we also have with COVID disease that is so mild in many cases that people are, to use the word that's in vogue, asymptomatic. They don't even know they have it. And we have nobody in the hospital. When I look back on the flu season just passed, if we had the same statistics weekly now that we had in the flu season, the powers that be in Albany would probably move us back to phase 1 or 2. And my question is, how can this be a public health emergency when we have no one that requires hospitalization and haven't for weeks? And many people who get it don't know they have it. And we have influenza season passed where we knew there were 881 lab-confirmed cases. I assume some people died. Christine wasn't able to give me that number. And we didn't go through all of this. What's the difference?
The difference is very simple. It's what's called excess mortality. Any flu season, we know there's an excess mortality nationwide of 20 to 40,000 people. Bad season, it may go to 50,000. We're at 133,000 and counting at the moment. That's a public health emergency. That is a disaster. And it may not be happening here at the moment in Chautauqua County because I think we've been very fortunate that we have, by nature of the way our communities are designed, except for a couple of, in perhaps Dunkirk, Fredonia, and Jamestown, where the houses are a little close together, the rest of the people live fairly far apart, and the communal gatherings are fairly small. But we have 133,000 plus dead people, and the year is half over. And we are looking at up to 200,000 deaths. That is a public health emergency, and it is national. Of course, it's different in different places, and our initial response was just to shut it all down, and maybe Chautauqua County didn't have to go as far as that, but that was the decision made politically. But this is truly a public health emergency.
I think too, Dave, the one thing to remember, and as I relied on my medical staff, I think that the importance of this also, it's a novel virus. When this hit, there were so many unknowns. Influenza, we've known, it's been here. We have strategies, we have therapy, medications and stuff to help this. But the coronavirus was so novel that once they saw what was happening, they erred on the side of caution. So again, it may be mild, it may be not as impacting as influenza, but I think the other point of it is it's still so unknown. Remember, treatments at the beginning have changed a lot to the treatments that they have now. We've learned from our mistakes and, have improved. But again, I'm a firm believer that the novel virus is what it is. And with that lack of understanding and knowledge of this virus, is everyone wants to make sure that we are erring on the side of caution and doing what we can to prevent those numbers so those mortality rates stay low.
Thank you, PJ. Thank you, Dr. Burke.
You're welcome. There's one thing that came into mind as we started wrapping this up. And I said this before, and I know it's something that I always took to myself. Challenge yourself. I challenge myself to be the best I can be. I challenge everyone in Chautauqua County to be that hand when we were starting this, to be the person who reached out to our neighbors, to be the person who extended that courtesy, to take care of one another's. But I also challenge everybody now to do what it takes to be disciplined, to do what it takes to save someone else, to protect someone else. Parents know this. It's something that's inherent. Once you have a child, what you fight for changes immensely. But think about that when you go out without your mask. Think of that as you're a young person, that are you going to catch this? And if you do, are you going to be asymptomatic when you talk to your grandmother, your aunt, your uncle? Or are you going to talk to a friend that may have an underlying comorbidity they don't even know about? We don't know what's happening. We don't know who we come in contact with and what they do on a daily basis and who they are and what is going on in their lives. Don't be that person who infects somebody. Don't be that person who they can go back to and say, you were the close contact. I caught it from you. Challenge yourself to do everything. Challenge yourself to be disciplined. Challenge yourself to come through this when we finally finish this crisis. The one that said, I did what I needed to do. I took the measures. And at the end, I can be happy with what I've done. Throughout this entire crisis, we continue to be, and I still urge everyone to be CHQ strong. Thank you.